Good morning, everybody, and thank you for joining my briefing this morning. So what a few weeks it's been, and I'd just like to start with a few reflections of the last few months, really. I've been more proud than I've ever been to be part of the NHS. It's been a really tricky time. It's been a time of extraordinary challenge, personally, professionally, for the system, for individuals, for our patients, for our families, for those that we care about and those that care about us. And through all of that, we've held what we believe to be the most important thing in our lives, which is keeping our patients safe, which is providing the best possible care to the people that we serve through extraordinary circumstances. We've seen teams come together in a way that we've never seen before. We've seen people go and work in strange environments and be welcome to work in those environments and to be trained and to be supported. We've seen systems and processes set up within days, if not hours, that in the past would have taken weeks or months. I was reflecting on how quickly we set up the antibody testing just last week, the best process, I think, in the country, in terms of giving staff the access to antibody testing. As just a tiny example. And through all of that, we've had to maintain our families. Through all of that, we've had to maintain and in a sense contain our stress and our anxiety about working in these circumstances, and then taking our fear and our worry back into our homes and to the families and to the people that we love. And we've had to stand in bloody queues outside the co-op, and we've had to stand in queues to do all the things that used to be so natural and so normal, all of that adding to stress. So with all of that, we've held each other, we've supported each other. We haven't always agreed with each other, and some of the conversations that we've had have been difficult because we're working in extraordinary circumstances in unprecedented times with unprecedented pressure. But through all of that, we've held what is dear to us, which is supporting our colleagues and supporting our communities. And we've seen the support that we've had from our communities and from our colleagues demonstrated on Thursday night at 8 o'clock, demonstrated by the number of rainbows which exist all over the counties, it seems. But now we're moving to a new phase. It's no doubt that thankfully the numbers of COVID-19 infections right across the country are reducing significantly. The number of people who are becoming seriously ill and requiring care in our ITU units have reduced enormously. And thankfully, the number of people dying from this awful virus have also reduced. But we are moving, I think, into potentially a much more difficult phase, which is slowly and carefully and safely restarting our businesses, restarting the care to the people that we serve. People have waited a long time for their care, even before COVID-19, and sadly now they're going to have to wait even longer. So as we move into that recovery phase, as we move into that reform phase, it's really important that we're mindful of also how difficult this is going to be for many people, not least our patients. There is, of course, the desire to move things on very quickly, but we have to be sensible and we have to be safe. There are several constraints that we have: PPE, workforce, buildings, social distancing, testing, swabbing, a load of things that are going to affect how quickly we can start to provide care in the way that I know you want to going forward. Our waiting lists have grown enormously over the past 2 to 3 months. But there's also something which is concerning me perhaps more than anything else, which is the fear in our community about coming to health. Whether it's going to visit your GP, whether it's coming to the hospital for an urgent operation. And we've seen a significant number of patients refusing or not wanting to come to the hospital because they're so afraid of contracting COVID-19, so afraid to leave their homes. That's a real concern to me, because we do know that clinically people are going to be at much greater risk if they don't come forward and have their care, then they would be potentially, even if they caught COVID-19, and we know the risks are very low because of the precautions that you're taking. I think we've all got responsibility, all 10,000 of us as employees of ESNEFT have got a responsibility, a personal responsibility, to spread the news that it's safe to come to hospital, to spread the news that it's safe to go to your GP. Just in the last 2 weeks, I've heard of two very, very distressing cases. One, only a 17-year-old who didn't present when they were concerned that they had cancer, and have now presented in a situation where they can't be treated, they can't be cured, and we can only offer palliative care. Had they have come sooner, had they not been afraid to come to the hospital, their outcome could have been so different. And another story of a 58-year-old person who died in one of our A&E departments because they hadn't come forward for urgent cancer treatment that they were booked for. That breaks my heart, as it breaks my heart when I see the mortality that we see from COVID. And I think we need to take that responsibility as the NHS, as the country, to make sure that we remind people that it's safe to come to the hospital and it's safe to have your care. So that, as I say, is something that we can all do. Yes, we can do the work through the press. Yes, we can do the work. But your message to your friends, to your families, in your communities, reassuring people that it's safe to come to the hospital. It's as safe to come to the hospital as it is to go anywhere else. Interestingly, we've just been doing the antibody testing on I think over 1,500 staff now, and I think we've got over 5,000 that are booked in over the next couple of weeks. Now, all that does is tell us whether or not we've had, sorry, I've just seen that Shane's told me it's 6,000, which is 60% of our staff. I have to remember all that does is tell us that we've had the infection, that we've at some stage come in contact with COVID-19. Many of us perhaps not have had showing any symptoms at all. But we know therefore that there's a lot of COVID out there in the community, and it's going to be the same in hospitals, but hospitals are safe places to come. So please take that message back to our communities. Before I ask Paul Fenton to talk about social distancing, some more details, just a couple more points from me. Let's not lose all the great work that we've done in terms of changing the way that we deliver care. Let's not assume that people have to physically come to hospital to have their care if we can provide it virtually. Let's not assume that people have to come to hospital for things that we could do differently in the community, for example, because we have managed to keep things going. We have managed to continue to care for people as outpatients. We have managed to transform our services, as I say, in a matter of days, sometimes hours, that it would have taken months or weeks beforehand. So let's not lose that reform, and the work that Mike Mears is leaving on recovery is also including work on reform for both inpatients and outpatients. The psychological challenge that all of us face in terms of continuing to manage our lives, continuing to support our families and those that we care about and those that we love, is difficult because there's no obvious cutoff point. We know that COVID is going to be with us for a long time, and certainly we're thinking about years and not months in terms of our planning as we go forward. So all the things that we'd normally look forward to, our summer holidays, our downtime with our families, is sadly probably not going to be the reality this summer. So preparing ourselves for that, I think, is important. The most important message, however, that I want to talk about today is around social distancing. I have not seen effective social distancing in either hospital site for weeks, if ever. Just yesterday, I stood in the corridor at Ipswich. I'm at Colchester today, and I'll do the same. Every single group of clinical staff that walked past me, and every single group of staff that walked past me, were less than 2 meters. That is a significant risk to you, to your families, and to your patients. We have to take personal responsibility for social distancing. We have to take personal responsibility for protecting ourselves, protecting our families, and protecting our patients. We also have to take responsibility to challenge people when we see that people are not social distancing. I know it's difficult. I know it's difficult to have a conversation with somebody walking down the corridor when you're 2 meters apart. I know it's difficult in some workspaces to maintain 2 meters, but we have to do it. We have to do it to protect each other, but we also have to do it because we're role models. It's very difficult to ask patients to social distance when they see a group of staff cluttered around one computer in a clinical setting. We will provide more computers. We will do everything that we can do to give you the opportunity to social distance. But ultimately, it's your responsibility. And if you can't social distance for whatever reason, you need to let us know, and we will do everything in our power to support you to do it. But we can't help you social distance walking down the corridor, or standing in groups, or chatting, or sitting outside in the sun having your lunch. You have to do that. So please, please, please do that. Please take that personal responsibility to protect yourselves, protect your family, and protect your patients. I'm going to ask Paul Fenton now to talk in some more detail about the measures that we're taking around social distancing. And please send your questions in. I know that some of you will have done already, and we'll get We've got additional people who could answer your questions immediately. So we've got Shane Gordon, who can answer any particular questions about testing. We've got Karen Luff, who can answer about the reform and recovery. We've got Lee Howlett, who can answer any specific HR issues. And then I can pick up any more general points as we go through. So as your questions come on, they will answer online. And if there are any left over at the end, I'll pick them up as we go through. So with that, I'll hand over to Paul.
Thanks, Nick, and good morning, everybody. Some sobering messages there, particularly around those two patients that Nick mentioned, and indeed getting our hospitals back to normal. Most certainly, as Nick has said, we have to lead by example. So last week, our social distancing guidance was approved, and we will be implementing a number of social distancing measures across all of our sites, including those in the community, to ensure the trust complies with the social distancing rules introduced over the last few weeks as a result of COVID-19. Now, we want to do this not because we have to, but because we want to get our staff safely back to work and to give our patients and visitors the confidence in returning to the hospitals for their much needed treatment or to visit their loved ones. The social distancing guidance document is published on the intranet. It's available to all staff, and it's a tool for managers, for team leaders, for departmental managers, for ward sisters and matrons to use for implementing social distance requirements across the trust. And in returning to whatever is the new normal, whatever that may be. And it will be a different way of working. It will require thought, planning, effort and changes on a daily basis to ensure we all stay safe. The guidance document we've introduced is as comprehensive as we can make it. At this moment in time, all organisations are having to change to this new situation, and we're learning from one another. But this document has a number of key principles. Firstly, to maintain a safe working practice by adhering to the 2 metre or the 6 feet approximately distance rule in line with national guidance. Now, I know there's been lots of conversations around, is it 2 metres, is it 1 metre, for how long? Actually, the 2 metre is the gold standard. The 2 metre is the one that people easily recognise, and the 2 metre rule is something that sticks in your head rather than any confusion. So we're sticking to that. It's gold standard, but that's the way it has to be. Where it's not possible to meet the 2 metre distancing rule, managers and staff must ensure that a risk assessment is completed and any mitigating actions are in place for their staff. And where PPE is recommended or required, managers must provide adequate training for staff And indeed, staff must attend that training to ensure that PPE is used correctly. And of course, there is further guidance on the intranet should staff want it. Lastly, to ensure that all staff and patients adhere to the social distancing national guidance. Now, we're adapting the workplace. So my team within Estates and Facilities, commencing yesterday evening, have begun a programme of work across the hospital, and that programme will continue over the next few days and in fact few weeks, to install demarcation tape along all of the corridors with signage, to introduce a keep left or one-way system as much as possible, to introduce additional hand sanitizer stations at all entrances and other areas within the main hospital sites, and where access to hand washing facilities may be difficult. We're installing perspex screens, demarcation tape and retractable barrier controls in outpatient departments and across the main entrances. And we're trialling some clear screens and curtains in inpatient wards at the moment to ensure social distancing for our patients. However, the distance between beds varies across the sites, anywhere between 1.5 metres to 2.4 metres. So in some circumstances, some wards will require the curtains and screens, and in others they won't. And we'll be working with the ward sisters and the matrons and infection control to that extent. So actually we're going to be adapting the workplace, but there are a number of things to which you can all do to ensure social distancing and to adapt your workplace. If I look at ward practices, review your ward practice to minimise the close contact between groups of people in your ward rounds. And for prolonged periods, for example, avoid congregation around the central nurses station, restrict the number of staff on ward rounds, conduct handover sessions in a setting where there is space for social distancing. Reorganising your workplace, and that's going to be around moving workstations around. Estates and Facilities and indeed ICT will be assisting you in doing that to ensure that we provide safe social distancing in all our office spaces and all of our other departments. So move chairs and tables around, particularly in meeting rooms. And when you use meeting rooms, we'll be providing Clini wipes to ensure that tables and chairs can be wiped down both before and after use. In reception areas, Estates and Facilities, as I said, we're marking the distance markers, the 2 metre distance indicator tapes on the floors, and installing the clear acrylic protection screens in front of the desks. Hearing loops must be activated. We have to be cognizant that clear perspex screens can sometimes be very difficult for those who are hearing impaired to actually read the lips of receptionists and ward clerks at receptions. So we are cognizant of that. So ensure those hearing loops are in place. In public lifts, when transferring patients, staff and patients can travel on the lift. During the time spent within the lift, there is no requirement for separate lifts from an infection and prevention and control point of view. On PPE, a big issue I know. Face covering and masks for colleagues. If you work in a clinical area, your team leaders will advise you what face mask you need to wear. You can also follow the personal protective equipment guidance on posters in clinical areas and the latest guidance on the intranet. All colleagues who work in offices or areas where the 2 metre social distancing space cannot be observed are invited to wear face coverings. If you opt to wear a face covering, you can wear this in corridors and communal areas of the hospitals if you wish to do so. Colleagues are asked to supply, however, their own face covering. But please, again, be cognizant of any patients, any other staff that you come into contact with who may have difficulties in understanding what you're saying, particularly those who are hearing impaired. A face covering is a cloth that covers your mouth and nose while allowing you to breathe comfortably. It can be as simple as a scarf or a bandana that ties behind the head. And again, please refer to the social distancing guidance, and it will assist you in those aspects. A few other things, we're doing additional cleaning in all areas. From a Estates and Facilities point of view, that's all clinical and non-clinical areas. So you will see extra cleaning in all areas. But decide if those cleaning arrangements you currently have in place are enough to ensure that cleaning is done thoroughly in the times when you're working. You may need to think about what extra cleaning needs to be completed during the day. And we're introducing a clean and sanitize as you go. So you may need to wipe down offices, desks, wipe down chairs, tables, and other equipment before and after use. We'll be visiting all office areas, assisting in those risk assessments to ensure that you can work safely within those departments. Risk assessments, of course, will need to be completed, and areas where a risk assessment is required is if you share your workplace with others, you will need to decide how you can manage this. You must identify areas where your staff and indeed yourselves will come into contact with others and plan what needs to be agreed to be put in place to keep the 2-meter distance. We're carrying out a number of space assessment risk assessments, but it is again the responsibilities of managers to let estates and facilities know what areas that they can safely bring their staff back to work. So should you come to work? Well, the Operational Restart Group, through the Recovery and Reform Group, as Nick has said, led by Mike Mears, is agreeing what services can safely recommence to ensure that we can all comply to the social distancing measures. If you're currently working from home, then please continue to do so. There are around 1,200 staff, so I'm told, that are currently doing that. And in applying the social distancing measures, we can only safely accommodate around 50% of you currently back into the workplace. So your line manager will be in touch to discuss your return or indeed arrange changes to your work pattern. Please discuss it with your line manager. Please refer to the social distancing guidance. It has 4 protocols that have been developed for particular areas, for outpatient areas, for inpatient wards and day units, for office accommodation, and for general areas. Please look at the social distancing guidance and please ensure that you contact us if you have any queries whatsoever. The contact details are in the guidance documents themselves. And lastly, if you have concerns about social distancing at work, if you feel you're unable to provide a safe care to patients or have concerns around your working environment, by following the social distancing rules, then you should immediately discuss this with your line manager. If you're unable to do this for any reason, or if you've raised it with your line manager and you're unhappy with the outcome, then please contact the Freedom to Speak Up Guardian. That number, that contact detail is in the social distancing guidance. And lastly, I just want to echo Nick's points. All organisations are adapting to this new era, this new normal that we find ourselves in, and it's important that we get it right. However, our social distancing success is reliant upon one critical factor: you, our staff. It's incumbent upon every member of staff to challenge others who are not social distancing, whether that's in corridors, in departments, in office spaces, or in wards. You'll be protecting yourself, and you never know, you could be saving their life. Back to you, Nick.
Unmute, unmute. I've got everybody shaking their head at me going, unmute, Nick, unmute, unmute. I'm unmuted. So the first thing, thank you for all your questions that are coming through, and thank you to the various people who are answering them. There's a few that I've picked up that I'll answer, but there are a lot of quite detailed questions in there about your own specific area. And as Paul said, you need to contact your line manager, and then they will get the specialist advice from Paul and his team, or from other colleagues as required. It isn't terribly easy to pick up all the questions because of the way that they're set out here. But there's lots of questions. For example, who do we report to if you work in offices where it's impossible to social distance in? Please talk to your line manager. They will contact Paul and his team, or take advice from HR, or take advice from the operations team, and we will be able to hopefully sort that out as quickly as possible. There's a question here: will there be an opportunity for shielding staff to get an antibody test? That's a very good question. I'm not sure that we've necessarily thought about that at the moment, because it would require you at the moment to go into hospital because it is a blood test. So I think at the moment that would be quite difficult, but because it would require a phlebotomist, either a community phlebotomist to come to your home, or indeed for you to leave home and go to a health setting. So at the moment, unless we hear anything different, we will put out the answer. I think that would be tricky, but it is something that we're looking at nationally about how we roll out antibody testing to all NHS staff, including those who are shielding. I'm on a national call later about antibody testing, so I will pick that up with the national team. I don't think we've got an immediate answer to that, I'm afraid. Most of the others have been answered. Thank you. So hand gel in the villas at Colchester, please talk to your line manager or talk to estates. If you contact estates, they'll be able to provide the hand gel in those areas. I suppose, as I've said before, please don't wait for these briefings in order to raise your concerns. If you've got an immediate concern, please raise that. Karen's answer to the next one. Office-based risk assessments in Clacton. We will make sure that all of our community hospitals, those risk assessments also take place. Paul, if you can nod or shake your head. I'm not sure that we've been to Clacton yet. No, we haven't, but we will be getting out there within the next few days to Clacton. Keep left would be great. I think that's a really good. Keeping left in the corridors would be really good. See, somebody there's had to ask several people to move. Shane has answered the question about the accuracy of antibody testing, remembering it does not confer immunity on you. All it means is you've had the virus. Again, there's another question about social distancing. Yeah, the other point is, of course, sharing toilets and kitchens and everything else. That is absolutely right. So it's a combination, isn't it? It's remembering basic hygiene. It's remembering universal precautions around bare below the elbow, and constant washing and wiping down surfaces. It's not just one thing that's going to protect us and protect the people that we care about. I think there's a good point about the heat of the taps. Yes, the balance between Legionellas and what have you. I certainly know that often I have to use a cold and a hot tap in order to get that 20 minutes. Staff testing, so there's a question there about the booking team. So please go online at staff testing. Most people have been able to do that. If you do have problems, then please contact, as you can see, that email address, which is stafftesting@esnef.nhs.uk. So any questions that you've got about staff testing, please contact that email address. A really interesting question. Could you give us some idea when all staff will be able to turn back to site? I don't think all staff will ever have to return back to site. I think some staff are finding it beneficial to work at home. It may be that people do a kind of hybrid job, that somebody spends Tuesdays and Thursdays here one week and Monday, Tuesday, Wednesday the following week, and their colleagues spend alternate days here. We're going to work all that through with your teams. But I think I can't see a time in the future when everybody will be back here working on site, because I don't think it's necessary in terms of the success we've had of working from home. There's a question about who pays for additional PCs. Well, we'll sort that out. I think that we have got, if you do need additional PCs, if you can identify them as being COVID or social distancing related, but please send them all through the central requesting if they're requested in that way. Let's not worry too much about who pays for the moment. Let's get people safe. We can worry about the money later. I'm only saying that because Adrian Marr's not on the call, or at least I can't see him. I suspect he's there somewhere. I'll be in my office as soon as I turn this off. But don't go mad, obviously. Be sensible. It's taxpayers' money. But don't worry about too much who pays. Who can have an antibody test? It's anybody that works on our sites. We are aiming over the next 6 weeks that everybody in the NHS has had the opportunity to have an antibody test. That's all 1.3 million people. But at the moment, it's anybody who works on our site. We will be extending that beyond to all of our staff. And community staff, I think Shane can also book in, but they need to come on site for those tests. Is that right? Shake of the head, or he'll come back. So Shane will come back on that issue. He's doing this. He's not too sure, but we're working on that. We'll be working on that this week for our non-hospital based colleagues. There's a question about the specifics around the poor eyesight. We do need to make sure that we're mindful of that. These answer the question. Small waiting room, again, if it's small, please, we'll have to accommodate it as much as we can. Again, if you've got specific issues, talk to your line manager or indeed talk to estates. Blood testing should be back in a day. It should be back within a couple of days. If you haven't had, please, again, as Shane advises, go to the staff testing website, email address, stafftesting@esnaf.nhs.uk, and we'll find out as quickly as we can what's happened to that. Is there a risk assessment for people who can't work? Yes, there is. So we'll again talk to your line manager or and Paul will work on that. Who will pay for the mitigating physical? Paul will pay. Estates have got very deep pockets. They'll cover the cost of everything. You can't see him, but he's shaking his head, and he's now holding his head in shame, I think, or anxiety. So there's a question here about people who go on holiday and then have to self-distance. Do you know what? I'm going to say what I really think. If you choose to go on holiday and you then put yourself in a position where you have to self-isolate for 2 weeks when you come back, you take that as annual leave. I think that's only fair. I don't think it would feel right for me to allow staff to effectively have 2 weeks self-isolation that we pay for because they've chosen to take a holiday abroad. There may be some extenuating circumstances that are very, very specific. For example, having to travel abroad and then having to self-isolate, but that would have to be signed off by the HR director and your relevant director. My view is that if you choose to go on holiday abroad and then have to self-isolate for 2 weeks, you take that as annual leave, and you'd have to discuss that with your manager, because it may be that you can't take 3 or 4 weeks annual leave at that time. That's my view, and I'm getting various nods from various people on the call. We have to be responsible. You know, we'd love to allow anybody to do what they wanted, but at the end of the day, our patients rely on us to be here, and I know it's horrible. I hate the thought that I won't be going probably abroad this summer and enjoying a holiday, and I'm sure many of you feel that way. Those like myself who are fortunate enough to have those choices, and I know not everybody is, but we have to be mindful of the ultimate responsibility we have as employees, which is to the people that we serve, ultimately our patients. Shane has answered the next one. So there was a receptionist who was a bit rude. I don't really want to answer that specifics. If you could email me specifically about that, then we are reminding people, of course, about how different the world is, and not everybody will have the right amount of information, or indeed have the right information, and it changes a lot. So I don't think we can be too hard on people who may not have all the information, but I think you're right. It's unacceptable to be rude or to not give of our best to the people that we serve, recognizing that these are very difficult times. People asking when we'll all be back to normal. I don't think we ever will, but there's a new normal, isn't there? So there's somebody here who said, yeah, so there's a question, there's a really good point there about we've got to send a message that it's okay to come to the hospital, but equally we've got to make sure that we're welcoming and that we've got the services that are here when people come in. So I think it's absolutely right that we need to make sure that we're not cancelling urgent appointments. The phases that we're going through at the moment is to make sure that all of our urgent work starts as quickly and as safely as possible. We are prioritising, so there are several meetings every week where we go through the numbers of patients and what their clinical condition is, prioritising those for those that we know where if there's a longer wait that their condition will deteriorate into a much more serious situation. I think also that's difficult because we need to be quite mindful about how subjective we might be being in some of those conversations and some of those thoughts, because getting somebody, for example, back to work, where they're the sole breadwinner to their family, entering what is probably likely to be a time of extended recession could be absolutely crucial to their livelihood and their well-being. And so we are trying to look at not just people's physical health, but also their mental well-being and indeed their home and family circumstances. That's much more tricky, but I think it's incumbent upon us to think about beyond just the clinical needs of people. Support there to say that we need to individually take responsibility. A couple of people have recommended that we have social distancing champions in the same way that we've had PPE champions and oxygen champions. I don't think that's right. I think we're all champions. I think it's the personal responsibility to ourselves, but also to our colleagues to challenge it where we don't see it. And many of you see me walking around, I'll just look at people and go, could you just step away? Could you just move away? I know how difficult it is. And certainly I would expect if somebody saw me less than 2 meters away from a colleague, I would expect and indeed welcome your reminding me and indeed anybody that we should be 2 meters apart. If we need air conditioning as offices, because of heat, who do we go to? I think that's a much wider issue. You know, we know that not all our offices indeed can we afford, or would it indeed be appropriate to have air conditioning. And there are rules which Paul is working on, and which our infection control team are working on at the moment, which is about the use of fans and air conditioning in areas which are either we know we've got COVID or we might have COVID. I think that's still being discussed nationally. I think, Paul, I'm looking for a nod or a shake of the head. Yes, it is. And therefore, we're expecting something probably within the next week that will advise about that. A statement. It's about time everybody takes responsibility for their own actions. I'm loving this. I find it incredible that everyone is constantly to be told, reminded about social distancing. We have to lead by example on every piece of guidance that keeps us, our patients, our loved ones safe. I'll be looking what I can change in my department to provide the best environment for my team to work effectively and safely. Craig, thank you very much for that. That kind of sums up my message today, and it's great that we've seen 24 likes on that. The yellow tape that's around the hospital, is it possible to have it placed on wards as an aid to remind staff? Yes, we will put some yellow tape wherever you want it. I think we've got about 25 miles of it stored away somewhere, so wherever you want it, we can put it there. We're having a hardware update to enable, can this be escalated? I can pick that up with, if you email Mike Mears about that specific issue, we can look into that. With regard to fans, I understand we're not able to use them in offices. Well, so yeah, we are waiting to see what the advice is about fans. If you hold off on that, I know some offices are very hot and some wards are very hot. They always have been. It's not just because of COVID, although we have had the driest May in history. Oh, there you are, information from me. We didn't know that. It's also the wettest February in history. So I don't spend my whole time just listening to the weather forecast. I'm not that sad, at least not yet. Can we have hand sanitizers in the education centre? Yes, I'm sure we can. If you just contact your manager, we'll sort out whether that's OCS or whether that's our own staff at Colchester. We'll chase that up. Screens be provided for admin offices where they don't allow social distancing. Again, it may be screens, it may be something else. Talk to your manager, they will talk to estates and find the best thing. All equipment is brought onto the wards, is ergonomically evaluated using all appropriate clinical specialties like myself. We'll do our best, Isaac. I don't think it would be, I think going through a detailed evaluation of every single bit of equipment that goes onto a ward for social distancing, we have to balance the urgency, but obviously we would do our best to make sure that things are ergonomically evaluated, particularly around any manual handling, obviously, and damage to staff. We'd be concerned about that. So we will do our best. I can't say that we'll get that every single bit of equipment that goes onto a ward will go through that process. Any chance of getting perspex screens in non-patient areas? Again, we can look at that, talk to your manager, we'll talk to the estates. I was unable to see any guidance on pool cars. I don't think we've got pool cars included, but presumably it would be wiping it down with wipes once you finish using the pool car. We will pick that up, so we'll look at that. As a person who's shielding, biggest fears have come back. I think that's really, really important for shielding staff. I think both physically and indeed emotionally, perhaps coming back to work after a significant time of shielding will be difficult. So I think that as more staff who are shielding are thankfully able to come back to work, there will be a risk assessment, as Paul talked about in his presentation, to make sure that the area you're working in is as safe as it can be. The Collingwood Centre, again, please talk to your manager. If the Collingwood Centre has specific issues, we will pick them up with estates. A line manager came into the office I work in with someone from estates and did not have the courtesy to come back and say what the outcome was due to social distancing. Well, I'm sorry that happened, but I'm not sure that we have the capacity to always necessarily go back to all the areas that we've visited and give the detailed feedback. It would just be the assessment that's made and then discussed with the line manager. So I'm sorry, but I think I mean, the estates are trying to cover obviously an enormous estate and our community. So I'm sorry that didn't happen. Training rooms at Colchester still have a sign saying these rooms are no longer serviced. How does this help with the prevention of COVID-19 when there's so much footfall? I think the balance, so we've had to obviously divert a lot of our cleaning staff into clinical areas. That is being addressed now to make sure that all our areas are clean as they can be. I think by service it was more about emptying bins and hoovering, which wouldn't necessarily be a COVID issue. I hope that services are still being clean, but if they're not, please let estates know. Difficulty in some of the corridors at Colchester full of trolleys. I think that's a really good point. There are far too many beds. We did order a huge number of additional beds and we haven't always had the storage for those. But I think not just at Colchester, but at Ipswich, we do need to make sure that the corridors are kept as clear as they can so that you can have that. I find myself sort of hugging the wall. I'm a wall hugger instead of a tree hugger now. So I think hugging the walls has got to be the message. So hug that wall, not physically, obviously, but hug yourself against that wall, I think is the message. Many businesses are extending until the end of the year. Is it possible for colleagues to be working at home? So I think if you can safely work at home, work at home. So if you haven't got the right equipment, so you haven't got the right chair at home, please discuss that with your line manager so that we can make sure that you're not putting yourself at risk at home. Working offices have limited space. Again, please take your specific issues to your line manager. They will discuss with the estates, do the risk assessment and advise. Will offices be adapted? Yes, I think we've answered that. So that's the same question. Plan for the education centre, again, talk to your line manager, estates will advise. Community buildings, we include community buildings in that as well. So thank you for that. Shared office, no social distancing, talk to your line manager. If the manager's working from home, very good question. If your manager's working from home, who do you talk to? Email estates, there's a number to call on the guidance, which is on the intranet. Please call that number if your line manager's not there and we can advise. A booking system for hot desk, I think that's a really good suggestion. So I think that will probably have to be done. Actually, that is a good suggestion. Thank you for that. So we do have some spaces. So, for example, there's a new area being developed here on the Colchester site, which is above the Costa and the Marks and Spencers. It may well be that we identify some socially distanced large areas where we can offer a booking for hot desking. That's a very good suggestion. We'll take that away and come back to you on that one. Further access to IT hardware for people working in different community settings. Yes, I think it's a really important point. We recognise that there will be a significant pressure on IT, and we have involved that, and we've already changed our business plan for IT to focus much more on home working rather than on desk working, and we'll have to keep doing that. It's great that people are concerned about whose budget it's coming off and everything else. Can we do the right thing and have the conversation about the budgets afterwards, but make sure that your finance manager is aware? And you've already answered that, Karen, so I don't know why I'm answering it. Thank you, Karen. What's the timescale for this? That would be yesterday. So so I can remember getting abused by my executive colleagues about 8 weeks ago when I went round with some yellow and black tape putting it on chairs, and I said, just you wait. I can see it, they're all nodding. I can see them thinking, they really thought I'd been out in the sun too long. Well, my case rests as some example. Social distancing has to start now. We just have to challenge ourselves, challenge each other, challenge whoever around social distancing. There are many people who never social distance. Many of them hold responsible roles. Isn't it time for them to be made an example of and disciplined? In some ways, it's not where I want to go. I don't want to be disciplining people for not social distancing, because I can absolutely put my hand up. There will be a time today when I will not social distance. There will be a time today when I will forget that I won't, at the moment I'm sitting 2 meters away from my colleague because I'm able to do it in my office. There will be other times today where it's going to be really difficult. And all I need to do is to be reminded. I just need to be gently reminded. And I think that if we constantly take that personal responsibility for ourselves and for our colleagues, and ultimately for our family and our patients, to remind ourselves of the importance of social distancing. I don't want to get into a situation where we're disciplining people. We've got a responsibility to make sure as employers that you are able to self-distance, or if not, the risk assessment and the appropriate PPE. But we also have an individual responsibility to do that for ourselves. So I know that if I wander outside here at Colchester at lunchtime, there will be people not social distancing, although I did have to remind 3 people at Ipswich yesterday or on Friday, and they told me that they live together. So that's fine. But so please, take personal responsibility. I don't want to make example of people and discipline people unless that becomes absolutely necessary. And frankly, I can't see a time when that would be appropriate necessarily. Community hospitals, again, we'll have to make sure. So that's great that you've already made some changes there. Can the villas be considered the same as any other areas and not forgotten? Hopefully that has happened. If it hasn't, please let us know and we'll look into that. Long term, can we become the new normal? It's 2020, no need to have thousands driving on site each day. Absolutely agree with that. We know that people have worked effectively from home. We will continue that as ours starting. As a ward clerk, I'm constantly telling people to move 2 meters from the desk. The printers are located behind me. I think that's a really, really good example of where we need to provide the best. We need to give people every opportunity to social distance. We can't ask you to work in a work environment where either you're not able to social distance because of the way it's set up, or if you have to work in that area, we're not providing you with the right equipment following the risk assessment. So please raise those issues specifically around. I don't think it could be that difficult, I don't know, to move a printer or whatever. I can see everybody in IT just holding their head and thinking, oh, what's he said now? So additional signs, so we're getting as many signs as we possibly can. I think I've already made the decision to triple the number of those sort of stand-up, pull-up signs that say, please stay 2 meters apart. We've changed the wording slightly so we're consistent with 2 meters. But Paul has said he's working on that, and I seem to have lost. Now I've got it back. We need to promote the unknown anxieties in colleagues and support them to be comfortable in work. I think that's a really, really good point. The emotional toll of every aspect of our lives that's been affected by COVID-19, I think is incredibly, it's really difficult. I find it incredibly difficult. For example, some weekends, ironically, perhaps even more than being at work, because you get so much from being at work, don't you? You get so much social interaction and a lot of your needs met. I think the anxieties for colleagues around COVID-19, the anxieties for patients coming back, we really need to understand. We were already talking about providing more psychological support to patients who are dealing with anxiety, as we have got a range of psychological support, more than we've ever had, to support staff. So the leaflet that we produced about a month ago, which is supporting people through that, there's a lot of advice and support there for staff. So please take advantage of that. I think also with patients, if you're sensing that a patient is so anxious that they can, that's immobilizing them, that it's causing them not to come in for urgent treatment, if you could let us know that, and then we can provide additional psychological support if that's required. Some people forget social distancing. It's human nature. Oh God, is it just? I haven't touched another human being for 10 weeks now. I hate it. I hate it. And then we know just around, the immune response from being hugged. I've been reading a lot about this. Skin hunger. It's a new thing, apparently. It's not a new thing, but it's got a new definition, a new words around it. It is incredibly difficult. But a friendly reminder, I think, is really important. So thank you for that, and be kind, as we know. We will always have our communal areas not being cleaned. Again, it's about that balance. So we have had to move cleaning into more clinical areas as the number of COVID wards and areas have reduced, and we should be releasing cleaning back. I'll pick that up with Paul just to see, and with OCS just to see how we're redressing that balance. So thank you, and Paul said that'll be addressed anyway. Karen's answered the next one. Paul's answered the next one. Shane has the detail of antigen and antibody. I know so much about antibodies and antigen now, not as much as many of my colleagues. No question, just advice on hand gel. Thank you for that, Fiona. A number there to contact. Most of the others have been. If you have been in very close proximity to patients, to test them, is there an option for patients to be issued with a mask if they don't have their own? I think yes is the answer to that. You need to look at the details, but I think that we are suggesting that patients do wear masks, and we will provide them. I've seen a lot of patients and visitors coming in with a whole array of masks, and perhaps the most irritating thing that I see when I'm out is people wearing gloves all the time and then touching them, and you just take your gloves off. It's so dangerous, but so far I've managed to resist the temptation to tell anybody. I've just been told we've got 4 minutes, so I'm going to rush through. Is anybody going to address the large groups of staff sit together in their breaks by the duck pond? It's exactly what I was just saying. So yes, so whoever sent that, yes, you could. So don't wait for somebody else. Not a management responsibility to remind people around social distancing. I absolutely would encourage, support and welcome myself to be challenged. So please don't wait for somebody else. If you see 8 people sitting having a picnic and most of them are smoking, same issue, raise it with them. Just remind them of the risk they're causing to themselves, the risk they're causing to their families, and the risk they're causing to their patients. When do we restart clinics? We're starting to start some clinics. It's not going to be a big bang. We're going to ring a bell, everybody's going to come back. We're doing it safely, we're doing it carefully, we're understanding the constraints and doing that. A lot of questions around assessments at home. Thank you for that, Sarah and Paul, responding to that. Community staff can book their tests at our phlebotomy clinics or through peer testing route. So just to say that, so you can either go to the clinics or you can book, go and collect your form, and then ask one of your colleagues to bleed you. Looking at my exec colleagues, I'd have to think very carefully about letting any of them near me with a needle, which is why I didn't. I went to phlebotomy. Staff continue to travel to and from work in uniform. Please don't. Please don't. If you're in uniform and wearing a mask, that is absolutely right, Joe. Thank you for that comment. Please think about the message you're sending to the public. You are ambassadors of the NHS. You are ambassadors of the NHS. I'm going to just finish off now, because we've now got, there's a few more questions here that we will, in fact, there were loads and loads and loads more questions, many of whom my colleagues have answered. But we will continue to put those answers up on the chat. We've had 130 questions. I'm sorry I can't get through them all, but we will be working with everybody to make sure that we can get these questions. There's a question here which I see Shane's answered. When will senior managers start winding down the crisis meetings and hand back to line management? we lose a full day a week in team meetings. I think that's a really good point, but as Shane said, we're still in a level 4 incident right now, so there is a command and control that I'm required. You know, I've got all sorts of new laws and everything that I need to respond to, and I need to be able to have that infrastructure. We have already rolled back, so we have a lot less meetings than we did have. We will only have meetings if we deem them to be necessary or we're mandated to have them. So it's not senior management winding the crisis meeting down. I'm afraid it is you know, way above my pay grade in terms of what happens at Cobra and at Whitehall. So finally, just a word of enormous thanks to each and every one of you. There are still thousands of people that rely on us every day for the unique contribution that you make to the communities that we serve. That throughout everything, throughout all your personal stress and anxiety, whether at work, that we've heard well sort of documented this afternoon or this morning in your questions, whether at home, particularly those of you that are shielding, you know, my heart goes out to you. I can't imagine how difficult it must be for you and the people that you care about shielding, whether you're self-isolating, whether you're working from home, or whether you're indeed working on one of our sites or in the community. Thank you so much for everything that you do. My message finally is about your personal responsibility to social distance, your personal responsibility to challenge your colleagues where you see it not happening. But in all of this, be kind, be safe, be well. Thank you very much.